I'm a veteran myself. I was in the Ohio Army National Guard back in the late 80s, early 90s. It is how I paid for my undergraduate program in social work. And at some point I wanted to be able to give back to the veterans, and with the current conflicts in Iraq and Afghanistan, I felt like this would be a really good time for me to do that. So for years I worked in the private sector, and what led me back was a move back to the Columbus, Ohio area, and an opening in the what we call the OEF program, the Operation Enduring Freedom, Operation Iraqi Freedom. The thing I love the most about the VA, though, is the broad spectrum of social work services that we have, and the ability to move up and to move around within our healthcare facility. With us being a large outpatient facility with 100 or 1,000 employees and 50-some social workers, that is a lot of opportunity for a seasoned social worker, and a lot of the services that we provide were very interesting to me. They all serve the veteran population, but they also do the continuum of care from very young age early on to elderly and dying. The VA provides services directly for veterans, not typically their family members. There are some ancillary services, but it's typically for the veteran. There's an eligibility criteria. Each veteran group or era has a different eligibility depending on what the government has determined, but they can come here for a variety of from primary care to specialty care services. So they start with a primary care provider, not unlike the community. That primary care provider is generally their gatekeeper and coordinator of care. There's a team. On that team is a social worker. There's a nurse, a clerk, a social worker, a provider, which would be an MD, a DO, a PA, an MP, some what we call second level providers. Then from there, they can have a variety of specialty care, and that specialty care can be neurology, cardiology, orthopedics, physical medicine, physical occupational speech therapy. We have same-day surgery here. We have sleep lab. We also have a very extensive geriatric program, geriatric services, a geriatric evaluation clinic, a social worker who works directly on that team to coordinate that care, which can then look at caregiver support services, respite services, nursing facility services, whether it's in the community or with the VA program, and then assistance with the family in times of death with death benefits. Social workers have a very large role here at the VA. We tend to be licensed independent social workers, LISWs, so we are able to practice independently in this setting. We do things from program management and administration, which is what I do here currently, to clinical work. We have LISWs that are PTSD counselors and social workers. We have what we would call therapists that work in the ADD or the addictions area. We have a large addiction services with drugs and alcohol, including Suboxone and methadone. We also can do community services. We have a very large homeless program where social workers work in the community with the various homeless veterans and shelters and services. We also provide, as I said earlier, primary care. Then we have our specialty clinics, which are pain management. We have women's clinic. We have the geriatric services, and then we have what does tend to cover a lot of geriatric veterans is our home-based services. So that's where a home-based team do visits. So that could be the provider, the nurse, the social worker. In these capacities, the social worker tends to be the team leader, the coordinator of care and services, which is what I've seen in the outside setting. The VA is very similar, except we're all under one roof. I think the thing that I also enjoy the most about the VA is there really is no ceiling for social workers here. Our previous associate director, and that's the second person under the director, was a social worker by education. And so that is the thing that I think the VA offers. If you have the knowledge, the leadership, the talent to do that, that is an area that you can work up to. So beyond your clinical expertise, there are administrative opportunities at any VA facility for social workers. I think the most fulfilling aspect is helping the veterans and their families. I do feel very passionate about the service and the sacrifice that they have given, both mentally, physically. Their families give a huge sacrifice. When people join the military, whether they deploy or not, it affects the entire family. The entire family has to move, has to pick up the slack when that person is not there, then has to put together the pieces. I think it's important that we provide the services we have said that we are going to provide to someone when they join the military. I think it's the least that we can do. So for me, I want to provide quality services. I think the VA hasn't always had a wonderful reputation. I think the Vietnam era was a prime example of the community and the government not standing behind its service members, and it was reflected in how the VA care was provided. That has changed over the years, and really has changed over the last 5 years that I've seen, where we provide state-of-the-art quality services to our veterans and then their families, and helping them out, from monetary to the actual services to the mental health services. To me, I couldn't think of anything more that I would want to do to help, especially with our returning veterans. I feel like we have a lot to learn from what we haven't done well. And when I say we, the VA, the government, haven't done well in the past, what can we do better? What can we do to help these service members recover, reintegrate, readjust to the things that they have seen with multiple tours and deployments? I think the most effective quality, and people may not totally understand this, you don't have to be a veteran. I have staff that are not veterans who are wonderful employees who connect to the veterans. I think you have to have passion. You have to have compassion, and you have to have empathy, not sympathy. These are very proud people who serve their country, our country, well. They are independent adults who should be treated as such, and I think it is important for us to have a respect of that. If we have respect for that individual, like in any area, the veteran will have respect for us, and that is the key to making a connection and working with that veteran. Understanding that they're not going to do everything that we want them to do. This is a constant struggle, I think, in social work and in healthcare. You know, the healthcare model is, this is what I say, this is what you should do, this is what will help. But the bottom line is, that's not what the person is ready to do. That's not what the person values. And the VA is really committed to patient first. And we have patient-aligned care teams. The social worker works on that team. And the whole point is to come from where the veteran's coming from. What do they want to work on? Why do they want to work on that? And then helping them achieve that goal, not the goals that we've set out. So as a social worker, we need to help remind people of that. Our co-workers, the public, they're prideful people. They're intelligent people. They have worked hard. They fought well. What can we do to help them to have the life they want? Not that I want, but that they want.